Good afternoon, viewers. My name is Cenise Glasgow-Fraser, and I'm a registered nurse by profession. Today, I'm pleased to sensitize you on the topic of protecting your mental health and psychological well-being during the COVID-19 crisis. COVID-19, commonly known as the novel coronavirus, has been declared a pandemic by the World Health Organization as of March 2020. Notably, this pandemic is not only engendering physical threat, but it is also generating psychological challenges. It has been reported that over 137,000 lives have been lost, and there are over 2 million cases. So I'm quite cognizant of the fact that this is a very challenging time for us. It is quite an unprecedented scenario in that for most of us it is something that we have never experienced. The reality of the situation is that we are all affected by this pandemic, irrespective of age, gender, nationality, profession, political, or religious affiliation. However, what is daunting to me as a healthcare worker is the cocktail of experiences that have been displayed by our very own citizens. Some of the experiences displayed are anger, worry, panic, stress, and even nightmares. For some, it is the fear of uncertainty. When will this pandemic end? For others, it is the fear of contracting this deadly virus. However, amidst of this challenge, amidst of what is happening around us, I want to encourage you to protect your mental health. Do not become overwhelmed by this crisis. You cannot afford to indulge in such unhealthy mental behaviors. You may ask why. The answer is simple. From a scientific perspective, it has been proven that sustained negative mental health issues, has significant impact on the body, including the brain, including the immune and the vascular system. This can increase your blood pressure, your glucose level, and also impair the immune system to function. In such case, susceptibility to COVID-19 will increase, and this is the very last thing we want to see. The goal, therefore, is to avoid as much as possible those numbers from exponentially increasing. And you may ask, what can we do? Allow me to echo some of the messages that were put forward by World Health Organization. I will target specific groups. First, the general population. Secondly, healthcare workers. Thirdly, parents. And fourthly, the church family. To the general population, I urge you to be empathetic and supportive of those persons who are affected by COVID-19. This is already a challenging time for them. Avoid as much as possible stigmatization. Do not stigmatize people who are COVID positive. Do not refer to them as the COVID family or the disease. Desist from doing so. Secondly, I want to empower you. I want to encourage you to empower members of the community to fight this insidious fight. As we know, efforts have been made to flatten the curve. Notably, social gatherings have been prohibited. As such, you empower your friends, families, and all community members to adhere to those safety guidelines that were given. Do not be an instigator of fear. Oftentimes we are guilty of instigating fear. However, desist from doing this. I want to urge you to minimize watching and listening to news about COVID-19 that may cause you to feel anxious, fearful. I'm not saying to you, do not keep abreast with what's happening, but minimize the time that you spend listening to those news, at least once or twice. Because guess what can happen? The barrage of information, the constant streaming of information can heighten your anxiety level. Get the facts and not the rumors. They are credible sources to get information from. These include World Health Organization, Pan American Health Organization, the Center for Disease and Control, and the Ministry of Public Health. Do not resort to unhealthy coping strategies. These include smoking or the use of alcohol. According to experts, these unhealthy behaviors will suppress the immune system and increase your susceptibility to COVID-19. To those persons who are in isolation or quarantine, this is not the end. You can win the fight. Continue to eat healthy, continue to practice respiratory etiquette, maintain good body weight. So you will have to ensure that you physically exercise. To the healthcare workers, you may be feeling under pressure, you may be feeling stress, you may be feeling worried because you are actually experiencing the brunt of the pandemic. However, that is quite normal given the current situation. It does not mean that you are weak. It does not mean that you are not true healthcare workers. However, managing your mental health is very, very important as your physical health. You have to be role models to the community. Of all persons, you understand the anatomy and the physiology of the body. So keep perspective of the situation. I want to encourage you, ensure that you have sufficient rest, eat healthy, stay in contact with family members. For some of you, your home may not be a safe place because you're being stigmatized by your very family members, and that is out of fear. In that case, embrace your colleagues. They may be sharing similar situations. Do engage in physical activity. Continue to provide support to those who need help. If it is too overwhelming and you may need help, seek help. To the parents, focus every day on what you can do and take actions. Be involved in a collective activity that will shift your attention, from the stress imposed by this pandemic. You can enjoy nature. Maybe it's an appropriate time to start gardening. Maybe it's an appropriate time to occupy reading. It can be an appropriate time to occupy your time wisely. You may have children at home, and children may seek much attention at this time. Be available to them. They too are affected by this pandemic. Taking into consideration that they have to deal with being at home, and also they have to deal with the idea of transitioning to that of an online learning platform. Be very supportive to them. Discuss COVID-19 with your children. Be very creative with activities that will enlighten them. Allow them to express their fears, and you do allay those fears and anxiety. You may also have elderly at home. Share simple facts about COVID-19 with them. You may need to repeat the information if necessary. The information must be clear, concise, but you must, of course, be very, very respectful. Help them to protect themselves. They may have underlying conditions, they may have comorbidities such as hypertension, high blood pressure, or pneumonia. Ensure that you protect them. Ensure that you have a ready supply of medication available to them. To the church family. It is also stressful to the church members and to believers at large. The church doors have been closed and thus fellowships have been thwarted. Nevertheless, I want to encourage you to keep prayerful. Heighten your prayer life. You can establish prayer lines with family, with believers. And this is an opportune time to build your faith and see this virus flee. There is absolutely nothing under the sun that is insurmountable for God to solve. Do engage in reading the Word of God and inspiration books that will build your character during this time. Keep communication lines very open. Communicate with your loved ones. Communicate with other members of the church. You can enjoy online relationship. However, be mindful of this. Sometimes the constant online relationship can redirect your attention from the pandemic. But guess what? It can also take your attention from the Word of God and from actually increasing your prayer life. There are opportunities for you to visit 3 to 4 church services on the online platform. Kudos to that. Relish the opportunity as much as possible. You can also listen to uplifting worshiping songs, and that can uplift your spirit. So these are some coping mechanisms or coping strategies that we can employ during the COVID-19 crisis. Remember, do invest in your mental health. The earlier, the better. Thank you for listening and have a blessed day.